Today, we will talk about insulin-dependent diabetes. First, we will see what insulin-dependent diabetes is. Pancreas is present in the human body. In insulin-dependent diabetes, which is also called type 1 diabetes, the pancreas stops making insulin or makes less insulin. Insulin is a hormone that is made by the pancreas. Insulin works like a key in the body, which helps sugar enter the cells, which gives energy to the body. If the pancreas is not able to make insulin, the amount of sugar in the blood increases, and this disease can be caused at any age. Insulin-dependent diabetes is not as common as non-insulin-dependent diabetes. About 5 to 10% of people suffer from insulin-dependent diabetes. So far, no one knows how to prevent insulin-dependent diabetes. But it can be successfully treated in various ways, such as managing diabetes by improving lifestyle, maintaining blood sugar levels, getting regular checkups, and learning how to control sugar. Can be done. What are the causes of insulin-dependent diabetes? It is generally believed that insulin-dependent diabetes is caused by an autoimmune reaction in which the body mistakenly attacks itself. The autoimmune reaction destroys the cells in the pancreas that make insulin, and these cells are called beta cells. Some people have hereditary characteristics in which the disease is passed from parents to children. Sometimes viruses in the environment also become the cause of insulin-dependent diabetes. Due to a good diet and lifestyle, insulin-dependent diabetes can be avoided.